Welcome everyone. Thank you for joining us for today's webinar, Guarding Against Insider Threats in Healthcare. I'm Shay Mann and I will be your moderator. Today's webinar is in listen-only mode. So if you have any questions throughout the event, go ahead and submit those in the Q&A panel and we will answer them during the Q&A session at the end of the presentation. This session will be recorded and we will email you a link to the recorded version tomorrow. Joining us today is SailPoint Senior Vice President Paul Truelove and Senior Manager of Vertical Markets, Larry Salazar. And with that, Larry, I will pass it over to you to get us started.
Thank you, Shay. We're covering a very important topic today, a topic that provider organizations like yours have expressed to us an interest in addressing. And that, of course, that topic is how do you thwart the insider threat to health data security, and at the same time do it in a way that does not have a negative impact on those who legitimately require information access rights as part of their regular workflow. Well, to get things started, let's take a look at where we are today in terms of security in general. Now, healthcare industry has really changed over the last decade, and it's continuing to evolve at a rapid pace. In recent years, we've seen increased adoption of new technology. We've witnessed the digitization of health data and consequently a growing demand for data sharing and interconnectivity. And what that has done is enable data access for a diverse user population that collaborates from a variety of locations. Of course, with change, especially ones that are as dramatic as what we're seeing in healthcare, comes new challenges. And what are those challenges? Well, considering that healthcare provider organizations have a truly diverse audience, a diverse user population with varying levels of requirements for access rights to a wide spectrum of modern and legacy applications, as well as cloud and on-prem technology, when you think about that, it becomes easy to imagine over 1 million points of access for a healthcare organization to have to deal with. But these points of access can easily become points of exposure, 1 million points of exposure, in fact. One of the things that you guys will have noticed, many of you will probably have noticed, is that research from the Ponemon Institute estimates that a single breach costs provider organizations on average $4.1 million. Now, if you're a small or a mid-sized organization, that cost could be detrimental. And even if you're a large health system, $4.1 million is not chump change. This is a tremendously significant number. And annually, breaches cost the healthcare industry $6.2 billion. However, even with these substantial numbers, the greatest cost to healthcare is how a breach impacts a hospital's operations and its ability to access information as part of its regular workflow. And a perfect example of this came earlier this year, and we won't actually go into the name of that organization, but essentially we had a U.S. health system that was hit by a ransomware attack, forcing the provider to turn to pen and paper after shutting down the entire network. And granted, this was not due to an insider. That's what was reported. But it does illustrate how a data breach can hinder day-to-day operations. Now, the reality is most of what we hear in the news is focused on malicious hacking from external parties. But it would be a huge mistake to ignore the insider threat. You take, for instance, a recent HIMSS survey, okay? So in this survey, there were responses from 125 health IT professionals. And of those, more than 46% of the respondents ranked employee security awareness and culture as their #1 concern when it comes to security threat exposure. And then you have another report issued by Pratinas which states that insiders were responsible for 4 out of 10 health data breaches in 2017. They had similar results in their reporting back in 2016. But other research, including Ponemon's Cybersecurity Intelligence Index, suggests that that number could be as high as 6 in 10 breaches being due to insiders. What's also interesting is that the majority of the insider incidents were actually due to error or non-malicious activities. However, breaches due to malicious insiders affected slightly more patient data. In all, if you look at the fourth bubble, you see that insiders ultimately affected more than 1.6 million patient records last year alone. Now, these stats are undoubtedly significant, but before we can even address those issues, we really have to first understand who the insiders are. Well, it's not your traditional FTEs. So today, provider organizations must look at insiders from the lens of access entitlements rather than employed status. In fact, your insiders are not just those that are listed on the left column of the slide, right? They also include your non-employed clinical staff. So you have your physicians, your nurses, pharmacists, but you also have vendors and partners such as food service, environmental services, and all the way down to volunteers. Here's the point. The point is if you are given, or if they are given access rights, they are on the inside. So moving on, let's talk about what would be the reason for why insiders trigger a breach or a leak of sensitive information. Well, to understand that, we've separated the reasons under three categories. First, many insider-related incidents are actually the result of accidents, meaning the user lacks awareness of processes or best practices. Then there's negligence. These are users who knowingly disregard established policies, not because they have malicious intent, but maybe because they're rushed for time, or maybe they have a false sense of security and feel that certain steps are not necessary. And then, of course, there are users with malicious intent. And most frequently, the motivation is centered on financial gains or even espionage. Now, regardless of what triggers, I should say, the insider leaks, the insider threat is not something that you can ignore, and let me tell you, here's why. Okay, so first and foremost, insider threats can go undetected for many years, and there's a price to pay for this. The longer you take to detect a breach or a leak, the more remediation cost goes up. Second, it's hard to distinguish harmful actions from regular work. When an employee is working with sensitive data, it's almost impossible to know whether he or she is doing something malicious. And then third, it's hard to detect malicious actions when something is happening, but it's even harder to detect after it happened. And the reason is simple. It's because it's easy for employees to cover their actions, and any tech-savvy employee will know how to clean up after themselves by editing or deleting logs to conceal malicious actions. So now, how do we address insider threats? Well, the fundamentals of security, especially when we're discussing about insider threats, is identity. In other words, if you don't know who is accessing what and how, you don't really have the ability to protect against unintended and consequential exposure. So what does this all mean? Well, to better understand how identity addresses the issues outlined, I'm going to turn over the remainder of our time to Paul Truelove, and he'll provide greater clarity on how to leverage comprehensive identity governance to mitigate security risks. Paul?
Yeah, thanks, Larry. As more and more organizations struggle to defend against internal and external threats, we're finding that identity governance is quickly expanding to address new and emerging issues. At SailPoint, we're taking a comprehensive approach in how we, attack identity governance and really feel that it is fundamentally becoming one of the best ways for provider organizations to reduce risk of inappropriate access to sensitive information in the enterprise, while also making sure that the right people do have the access they need to perform, their jobs on a day-to-day basis. So let's take a look at what this means in a little bit more detail. So first, a few comments before we dive into each one of these individually. But, there are a few common security caps in healthcare provider organizations that hopefully don't come as a surprise to anybody on the phone today. And I want to discuss not only the gaps themselves, but some very practical advice on ways that you can think about minimizing the impact of these issues within your specific organization. So the first one, inconsistent governance approach to various applications, including the EMR. This is a particularly challenging one because in most provider organizations, the EHR is the central core technology system for hospital operations. And, in many cases, the EMRs like an Epic or a Cerner might suggest that they have native access controls, and in that they would be right. There are native access control capabilities inside of the EHR, but that generally means that it's governed completely outside of the other processes that you're using for the rest of your IT infrastructure and your applications. And having separate governance processes, especially if they're manually implemented, can not only lead to duplication of effort, but more importantly, it generally leads to very, very ineffective security threats and an inability to really leverage a common approach to try to do the right thing from a security administration perspective. Not only that, but as you're bringing new people into the organization or transferring people within the organization, it can also lead to downtime from a clinical operations perspective. And so what we've seen in terms of addressing this gap is, that the EHR should leverage the same central identity governance processes that you're using, if not the same identity governance system. And so that, that may be more of a reflection on where you are as an organization in terms of your use of a technology solution for identity governance versus something that is more manually oriented. And part of the value is, taking the best practices that are encompassed in an identity governance system like SailPoint, the pre-configured connectors, integration, to all of the applications in your environment, including the HR, so that you really bring together a comprehensive approach and automate the provisioning processes, automate your controls and your auditing processes, and very consistently enforce policy throughout your entire IT environment, both within the EHR, but extending well beyond the EHR to all of your other systems and applications. The second thing then is lacking in proper segregation of duty. And I think one of the things that most organizations are finding is that the very diverse user population combined with dynamic responsibilities and the number of different IT systems at play in an enterprise today can really lead to a struggle to implement a model where you can control inappropriate access from ever occurring in terms of the way that you grant base access rights. And so segregation of duty policies really become a way to, be much more robust and be much more comprehensive and leverage the ability to automate the detection of inappropriate access combinations so that you don't have major issues surfacing within the enterprise. And I think in large clinical operations today, it's becoming more and more important to make sure that somebody doesn't have access to a particular process or a particular system whereby they can do something that is very inappropriate. It could be, prescribing and dispensing prescriptions, or it could be something in the finance organization where you're, creating a vendor and paying a vendor out of the same system. Those combinations are very challenging to see and to manage if you don't have the ability to have a single system of record and, comprehensive policy definition capabilities. So when we look at that, from a recommendation perspective on how to address the gap, it really comes down to a couple of specific things. One is leveraging a system that allows you to create the policies and automate them, but also leveraging an approach where instead of trying to do this at a very granular, almost entitlement level, you do it at more of a business role level, and you define the conflicts at a business role versus the underlying IT access. And then leverage the system to actually automate the scanning so that you can alert very clearly on individual users who hold conflicting access and make a business decision at that point whether you are going to allow that access to continue, you're going to put mitigating controls in place maybe to reduce the risk, or you're going to go through a process of reducing or eliminating specific access that they have to completely remove the SOD policy. Then we get into inadequate management of multiple roles per identity. And this is, particularly challenging, I think, in many provider organizations where an individual, kind of human user, if you will, can wear multiple different hats. But in healthcare provider organizations, we see that, not only do they wear multiple different hats, but the jobs that they're performing when they have those different hats on are very unique, and the access required is unique to that role. And so we get into a situation where, you have an individual human user that actually has different digital personas. So you can illustrate this if you think about maybe a unit clerk in the emergency department that may also be a nursing student who's doing a clinical rotation in the intensive care unit. The access that person needs changes in both of those roles. And in a lot of hospital organizations or provider organizations, the roles are transient, meaning they can change almost day to day. And keeping access aligned and really allowing, the business to manage the access associated with the role that the person, is in for one persona versus another can be a daunting task. And that's where, we really want to look at ways where we can, leverage technology in particular to try to help do a better job of delineating the access for the digital identity by persona, so that you are breaking up an individual's access and maybe even granting and revoking it on a real-time basis based on the role that they're actually performing within the organization at that time. And so, by number one, putting a system in place where you can gain visibility to 100% of the access that the human has, and you can understand the risks of the access that might transcend personas, but then very specifically drive the business processes at a more persona-based level. That's a powerful way to address this particular security gap. So then when we step into the last one in terms of inefficient processes around managing user lifecycle, this is something that, not only I think poses a real challenge to healthcare provider organizations, but a number of other organizations, that we see on a regular basis, where, the lifecycle itself may seem relatively simple. People join, they move or transfer within the organization between functions, and ultimately they leave. But the frequency of the changes and I think the complexity of the IT environments that we're seeing in most enterprises today can make this a very complicated process, and I think maybe importantly really stretch the operational realities of trying to do it manually. So when you stretch, beyond what a process can really deliver, that's when you get into significant challenges where I do think in healthcare maybe the risk is more acute in that, patient care can actually be compromised, security and compliance, issues can arise, and you can create a real situation that is ultimately detrimental to the business value that you're trying to provide. And so the solution becomes, again, taking an automated approach where you can, delivering tools to the enterprise, or the organization, so that they can perform some of these processes, without manual interaction. So a self-service access request initiation, maybe I am transferring to a new group, I can initiate that change, or my manager can initiate that change. Then we can leverage automated provisioning processes to drive the actual changes to access. Maybe it is defining, business roles, so that at least at a coarse grain level, there's a difference between, what a doctor is granted from a nurse, and I can make sure as somebody onboards or transfers within personas, that the base level of access is synchronized and delivered, or even something like password reset and password synchronization, that I give tools to the business so they don't have to pick up the phone, sit on, the help desk, sit on hold with the help desk, and then ultimately have somebody go in and manually provision changes out. Those types of opportunities to automate and leverage, a system, really do improve clinical and operational workflows and minimize human error. And that tends to be another area where when you stretch a manual process too thin, you end up not only with the process maybe, being ineffective, but the human error can really, lead to outdated or improper access rights as part of the process. So, in addition to those kind of 4 key gaps that we see, one of the other areas that is really beginning to stretch, I think, what is capable through most existing identity and access management processes is the reality of sensitive data on the move. And what we mean by that is information that might have started out in the EHR, might have started out in the HR system, a clinical application, or even a database where you're storing information, has all of a sudden moved into unstructured data. And if you look at the Gartner stat here, they I think recognize that somewhere around 80% of the organizational data that exists in a typical enterprise is unstructured, which means only 20% of it is structured, which means if you think about it in the grand scheme of things, if my identity controls are primarily focused on my structured applications like the EHR and other application-based systems, I'm probably missing up to 80% of the actual sensitive data that is being used in the enterprise. And there's a real reason this is happening, more and more and more. And it comes back to the fact that most of our businesses are built around collaboration. And I think every organization today is built around collaboration, both internally and externally. And a healthcare provider organization probably is at the forefront of that collaboration, based on what's required in a modern healthcare enterprise to really deliver the level of patient care that we want to have. And so, in a world where collaboration is mandatory and that sharing information drives the creation of unstructured data, we have to begin thinking about how to control access to unstructured data much more definitively than we have in the past. And this is just kind of an example of the typical day in the life of how unstructured data begins to permeate the organization, where I have a clinician conducting research through a study that may copy and paste medication administration information out of the EHR system into something like Excel, so that I can create a chart, or I can, up-level that information into more of a summary format. And maybe I copy that chart out of Excel and I put it in a PowerPoint because that's what I'm going to use, to show my results. Now, all of a sudden, I created a situation where I took information that was protected based on the person's access to the EHR, and I've copied the same sensitive data into unstructured documents, and now I'm placing those documents out on a file storage system. Could be SharePoint, could be Box, could be a Windows file server environment. It doesn't really matter, but now all of a sudden, I've created unstructured data, and it is now not necessarily covered by the identity and access management administration processes that it would have. And that, really is becoming a much more problematic area, both from a patient information security perspective, but also from an audit and compliance perspective. And so one of the things that we're really seeing is, you almost have to begin thinking about how you're going to govern access to your file storage systems where unstructured data resides differently than what you've done for your traditional application environment. And one of the reasons is you don't necessarily know as much about the file storage locations in terms of what data is out there. And that's, what you have to start with. You actually have to begin scanning systems to identify where sensitive data has all of a sudden been stored by your business users. And then you actually have to begin, unpacking that information and really looking at, okay, so for my provider organization, patient data and HIPAA-related content is maybe one of my big focus areas. But it could be financial data as well. It doesn't really matter. You can define what types of sensitive data you really want to look for. You can leverage tools to go in and scan and basically create a map of all of the file storage locations where sensitive data has been detected. And then, as you'll see over the course of the next couple of slides, we can give you some ways that you can extend your identity and access management program and your identity governance processes to encapsulate the information or the file storage locations themselves and the way that access is being granted to those. And then last, we can also begin to look at things like access behaviors, and we'll kind of wrap up on this thought as another mechanism to improve the application of our identity governance controls and processes to make sure that we are as proactive as we can be in making sure that threats aren't going unmitigated in the environment for very long. And so, as I said, we're going to kind of transition into, this concept of extending your identity governance strategy where, even if you already had some good processes in place and maybe some technology in place around, identity for your applications and infrastructure, access today stretches out to your file storage systems, and that, is a very necessary place to begin, leveraging the same types of models on these new systems to make sure as the data begins to move, we capture, where 80% of the risk is ultimately transitioning to. Because you want to take a holistic approach and align those identity governance processes across both your applications and infrastructure and file storage systems so that you really are developing, a much better mapping of where you have your identity governance controls to where your sensitive data actually resides now in the organization. And what that ultimately allows you to do, is take this comprehensive approach across all of the different processes so that you're doing a good job protecting your applications and your data, whether those things are on-premises today or in the cloud, or maybe in a state of moving from on-premises to the cloud, which is a pretty typical environment that we see in healthcare organizations, where that cloud is becoming, a much more relevant part of the IT infrastructure, either through technologies like AWS or Azure, where you're, maybe redeploying some of your internal applications on cloud-based platforms, or you're beginning to move from more traditional packaged software applications out to software as a service or SaaS applications, maybe for cost, maybe for convenience, maybe for a combination of both of those things. The interesting thing is, over the course of the last year, we've really started to see even the industry analysts, taking a similar perspective. This is a quote from the Gartner Identity and Access Management Summit last November. One of the lead analysts, Brian Iverson, that covers identity governance and administration for Gartner, in his talk about the expanding universe of identity management, really I think said something incredibly powerful, which is if you're not governing access across the application and data boundary, you're likely going to suffer more data breaches than if you do a good job of, a complementary or integrated approach to two technologies, and they're using identity governance and administration and data access governance, really to highlight the same thing that we were just looking at on the last slide about bringing those two universes together and making sure that you're being comprehensive in how you attack your identity governance processes. So, really important statistic here, I think, for us to think about in terms of how we might begin to evolve our approach, primarily so that we suffer fewer data breaches as an industry, and that I know is a key issue that's top of mind for all security practitioners, in healthcare enterprises today. So once we start thinking about expanding the world of identity governance, so that we're not only talking about a reasonable number of applications, could be hundreds, could be thousands, but now we're talking about file storage systems and the potentially billions of files that reside in those environments. The next thing we have to talk about is maybe using a slightly different approach than we have in the past so that we can really characterize high-risk threats from low-risk threats. And the reason we need to do that is I think what you will very quickly find if you ask your organization to pick up more identity governance process activities on a day-to-day basis is you can quickly overwhelm, your end users and your business managers, in your provider organizations. And so one of the things that we can begin to do is we can start using user behavior as a way to try to predict areas of high risk and areas where we may see new emerging threats happening. And so, part of my baseline in doing that is understanding, all user behavior, and then looking at suspicious activities in order to really begin to focus my controls on areas of true high risk. And that ultimately is going to be I think the secret to leveraging identity governance, processes and tools, but taking a more threat-based approach to cybersecurity so that ultimately we end up where we want to be, which is not burdening the business unnecessarily or burdening, your administrators unnecessarily, but really being able to track and prevent active threats from, taking over an organization very, very quickly. And so again, these are just some additional thoughts on how we would begin to take a more risk-based approach, understanding normal access behavior, leveraging some of the new machine learning technologies that are emerging within identity and access management systems, to produce a dynamic risk model. Then we can take that risk model and we can tune it. And we can add, new information to it, and we can let it, actually become a little bit self-learning. And that can then help us focus our identity governance controls on high-risk users and events. And so maybe if I have an access request coming in from a new user, but that access request is very different from the access possessed by other people on their team, excuse me, I can decide, instead of letting that just go to their manager for approval, I can ask a department security officer dynamically to engage in that approval process as well. And that gives me, again, a way to focus the controls. I don't do that on every access request, but I do it on ones that are a little bit more suspicious than others. I can also monitor who is accessing applications and information in real time. And again, if I see a behavior pattern that doesn't match the norm, I can begin to interact with that user and their access. Maybe I send their access off to their manager for certification. Maybe I send an alert to a departmental security officer to allow them to go in and review information. Or I can actually begin to become even more proactive where I let alerts and against abnormal behaviors actually drive real-time responses where I may not even wait for human interaction. I may go in and revoke access or disable access so that I avoid a horizontal threat, extending into other areas. I can always go back and add the access in, and I know there's a level of conservatism around some of the automated remediation, that may be necessary in certain parts of a provider organization, just so you don't have a situation impact the delivery of care. But again, sometimes just getting eyes on the process is enough, for somebody to go in and mitigate a real risk of further damage to the enterprise. So we've covered a lot of ground, but I wanted to wrap up with 5 key takeaways as we conclude the webinar today. Number 1, insiders account for a significant number of the data breaches happening today. And so while you should continue to invest in perimeter-based security controls, a lot of what we have to begin focusing on from a centralized security perspective, and definitely from an identity and access management perspective, is how we manage insiders and how we maybe become a little bit more predictive in terms of assessing the threat of an insider breach dynamically when it is happening and mitigate it very intentionally. Second, identity management is a foundational component of a modern approach to securing an organization. You cannot secure an organization if you're not governing access day in and day out. And you've got to make sure that stretches into all of your critical systems. So I still spend a lot of time talking to provider organizations where they may have started down an identity and access management program but not included the EHR. I would argue it's time to include the EHR so that we can do a much better job, of really encompassing everything. So you have a single point of visibility. You understand, every system that's critical, every file storage location that's critical, and that will become, a very important part of how we approach this. I also talk to a lot of organizations that still think provisioning is enough, right? I've got some automated provisioning rules in, I'm granting and revoking access, but provisioning isn't really enough in the modern enterprise. You've got to take a governance-based approach, and so that really is establishing a very conceptual model on who should have access and what that access should look like, as well as the automation of that on an ongoing basis. Automation is still a really important part, but you've got to design a system that more systematically defines, what appropriate access is, and then model things like SOD controls so that you can see when people have conflicting access rights and very explicitly go in and manage that process. And then, the next point, I think we've hit on a couple of different ways. It's no longer sufficient to govern access only to applications and platforms. You really have to look at the risk that is now in the file storage systems because of the files and documents that are residing out there and are a very intentional part of the collaboration of the enterprise, but if not managed, can ultimately be where the data breach actually happens. People will always try to attack, the area where they can get the most information, the most conveniently to them. EHRs might have been, the point that they would have attacked in the past, but now so much information is stored in file servers, in SharePoint, in those types of systems that if we don't protect those, we may not really be doing a good job preventing, threats from ultimately gaining access to the sensitive data, and both, I think, put patient confidence at risk, but also put you in a regulatory risk environment that would be unacceptable. And then finally, I recognize that the world is getting more complex and you're being asked to do, in a way more with less resources. And so that's an area where, I think the ability to really analyze behavior and further use machine learning technologies that are coming out as a way to really prioritize your activities and prioritize where you put your controls, that ultimately is going to be a real value add. Obviously, you have to be a little bit further down the maturity path, but once you get there, the ability to use some of the new technologies around, identity intelligence and machine learning are going to ultimately give you a powerful combination, to take back into your enterprise and really help balance the need to ask for, interaction in the process from an identity governance perspective with your end users and management and administration, while not necessarily creating a burden that actually impacts their ability to deliver patient care, which is the ultimate thing that we're all trying to do. So with that, I'll thank you for your time and turn things back to Shay, who will lead us into the Q&A portion of today's webinar.
Thank you, Paul. Just encourage everyone, if you have a question, go ahead and submit that in the Q&A panel on the side of your screen, and we will address as many as we can in the allotted time. So let's jump in with our first one. We are definitely aware of users extracting data out of the clinical system for various reasons. That said, what would be the best way to get started on tackling this issue? Paul, this may be a good one for you to answer.
Yeah, I mean, that, like I said, that's a pretty typical use case that we see, where regardless of the industry, there typically is some kind of operational system where a lot of the information ends up, maybe originating. And so the easiest thing to do is actually to perform a scan of your file storage locations and define some very basic rules for what sensitive data means. And so maybe it is, personally identifiable information that you would have, received from patient records, that could have been copied into Excel, unintentionally, maybe including social security number or, some other identifier that, is of a sensitive nature that needs to be controlled. Maybe it's the combination of PII and health information that really does trip your HIPAA filter. But, define some very, coarse-grained rules, and then you can use a solution that SailPoint has called Security IQ to go in and actually identify the locations in your file storage systems where documents reside that trip those filters. And so you could start narrow and maybe just do a Windows file share or a SharePoint site or a collection of SharePoint sites. But that'll at least, begin to give you a baseline for how bad the problem might be. Generally what we see is, information, you may have information storage processes and policies that, the organization isn't adhering to very correctly. And so, the opportunity then is to just begin to get an understanding of how big a problem this is going to be, and then you can really begin to refine, over time, exactly how you want to change behavior in the organization and maybe improve the ability to stretch those identity controls out to those unstructured data locations.
Okay, great. Thank you. Okay, next question. We have multiple facilities, some with legacy clinical systems, but with no immediate plans to replace them. How would you streamline the process around managing access to multiple systems? Larry, you want to answer this one for us?
Yeah, that situation where the provider organization has multiple facilities with multiple clinical systems is really not that uncommon. I mean, we see that happening a lot with providers, especially as they merge with or acquire hospitals and practices. But to answer the question, if you want to streamline the processes and drive efficiencies and mitigate security risks that would otherwise come from having to manually manage disparate systems, you want to unify that governance approach by establishing connectivity from your identity platform to the various clinical applications you currently have deployed. Now, we have worked with our customers, a number of our customers, to develop connectivity to some of the most commonly used EHRs. That said, if you have a less common clinical application that needs to be incorporated into your unified approach, and you have an environment that we can address or access, there's always the option to develop for you that integration. And again, doing so will help you to streamline efforts and mitigate security risks.
Great, thank you, Larry. Okay, our next question. Can these solutions be hosted or deployed in the cloud?
Yeah, interesting question. I think more and more as hospital and other type of provider organizations, look at how they want to deploy new technologies, there is a real decision to be made around, whether an on-prem footprint in a data center is the right, whether maybe a hosted solution, in an AWS or cloud-based IaaS platform, or a full software as a service solution. So everything that I've talked about today, when we look at it from a sale point perspective, and we weren't really trying to do a big product pitch today, but as we look at the way that we've mapped our solutions to those different realities, we've definitely created a model where you can leverage something from SailPoint directly in your data center, or you can leverage it from a cloud infrastructure as a service platform, or you can leverage it as a SaaS-based solution as well. So if you want more information, there's a ton of information on the website about our different product lines, and how those map to the different deployment options.
Great, thank you. Okay, that is all the time that we have for questions today. Everyone, keep an eye out for an email from us tomorrow that will include a recording of today's presentation. Feel free to share that with interested colleagues. We'll also include a link to a healthcare provider case study with Integris Health. And also, if you'd like to learn more, contact us using the phone number on your screen, or check out our website and sign up to schedule a demo to learn more. Thank you, everyone, for joining us today. Paul, Larry, thank you for the great presentation, and have a great rest of your day.
Absolutely. Thanks.
Thank you.